Follow us to stay updated on debates, discussions, facts, and tips about health. Click on the subscribe button and the bell icon for latest updates.
In recent years, landscape of dentistry in India has undergone remarkable transformations, making it essential for both dental professionals and patients to stay updated with the latest advancements. With the rapid pace of technological innovation, dentists in India are now equipped with the state-of-art tools and techniques that not only enhance diagnostic precision but also improve treatment outcomes. This shift is not just about convenience, it signifies a major step forward in raising the overall standard of care. These advancements provide more efficient, minimally invasive, and durable solutions for various dental issues, empowering patients to make informed decisions about their dental health while enabling professionals to stay updated with modern dental technologies. As we delve into today's discussion, we must acknowledge the necessity of staying ahead in this rapidly evolving industry with the potential to revolutionize dental care across the country. Welcome, everyone. I'm Dr. Soumya Saluja from THIP Media, and today we are thrilled to explore the fascinating world of modern dental technologies in India with the esteemed Dr. Professor Dr. Parthasarathy Reddy. Dr. P.P. Reddy is a pioneering figure in cosmetic dentistry, renowned for his exceptional expertise and innovative approach. With over 3 decades dedicated to refining the nuances of dental practice, Dr. Reddy has transformed cosmetic dentistry, elevating it to unprecedented heights at FMS Dental Hospitals Private Limited, recognized as Asia Pacific's largest corporate dental healthcare center. Dr. Reddy's visionary leadership has made world-class dental care accessible to all, transforming the lives of hundreds of thousands and breaking down economic and geographic barriers. By mastering advanced techniques such as digital smile designing, nemotech, and 3D printing, Sir empowers patients to visualize their smiles before treatment begins, ensuring personalized and precise results. Under Sir's guidance, FMS Dental has emerged as a leader in multi-specialty dental healthcare, setting global standards in patient care while advancing dental health and education. Through institutions like Sri Sai College of Dental Surgery, it promotes excellence in clinical practice and education. FMS has also been honored as the Aesthetic Clinic of the Year at the London IAE Awards in the year 2018 and as the Best International Dental Clinic by IMTJ in Berlin in 2019. Dr. Reddy's unwavering commitment to quality has inspired countless professionals to follow his model, making high quality dental care accessible across India. His legacy is not only defined by the advancements in dental technology and patient care, but also by the profound impact he has had on the future of dental education, ensuring that the next generation of practitioners continues to uphold the highest standards in the field. Dr. P.P. Reddy, THIP Media welcomes you, sir.
Thank you.
Thank you for your time, sir. Okay,
Yeah.
sir, modern dental technologies in India, they have significantly transformed dental care, offering more efficient and patient-friendly solutions. However, I feel that, many individuals, they may still feel apprehensive about these advancements, particularly, when it comes to new technology in
Yeah.
treatments. And some might even, fear the unknown and its impact on their treatment procedures. So, to address these concerns, I'd like to start this discussion with the most fundamental question, sir. That what are the most significant technological advancements in dentistry which are available in India today, and how do they enhance the precision and efficiency of dental treatments?
Let me come to dental technology now. If you look at it,
Yes,
We
sir.
have to talk about the infrastructure, like, including the equipment, chairs, and even the smallest instruments we use, then the materials, there is a technology and the procedural improvement, and there is
Right,
always a software and digitalization improvement. So everywhere there
right,
is an improvement. Our chairs are
right.
becoming more economical and probably more comfortable than earlier one.
Yes,
And
yes,
if you look at it now, the earlier impressions are moving on digital, which is more comfortable, no gagging,
yes,
etc. And the
yes,
material science is improving. If you look at composites, they're much more, you can use it layered and you can do it much more translucent than earlier
right,
one. And
right,
everywhere there is a procedure to everywhere there is an improvement. But the most
right.
significant I look at is digitalization. That's
Okay,
the biggest change in the transformation in the practice. But if I see in the last 1 decade or probably last 5 days, 5 years, I've been looking at for last 30 years how we were practicing, and then last 5 years how it is changing drastically. And it's
right,
actually giving a lot of comfort to the patient in every aspect. May it be
right,
a crown, may it be, the comfort. And
right,
yeah, when it comes to phobia is there, which will take another generation to go, because when we
right.
were childhood, we have been shown in the TVs like a dentistry is very
Yes, yes, very
painful, and
scary. Yes,
it is like screws and mallets and all. So there is
yes,
something psychologically inherent thing. It will take little time for us, but
yes,
definitely even the sounds. If you look at the turbines, what we use today, even the
yes,
chairs, the sounds of noise of the aerotas have come down. And if you
yes.
look at the clinics, you see most of the clinics today has got much better interiors than the earlier one.
Yes,
When the people
absolutely.
walk in, a good music to a good reception, and
Yes,
everywhere there is something, where they feel it's not a hospital, it's something,
yes. So it's a more environment friendly zone for the
yeah, where I
patients.
can little more in. So
Okay.
everywhere it is changing. That's what I'm changing. It's not just a only the technology,
Yes.
probably our environment to the chairs to.
So now talking about digitalization that you've mentioned, that it has vastly improved almost all facets of life, including dentistry. So I'm going to start with this. How is digital, scanning replacing traditional dental impressions in India? And what are the benefits for patients, in terms of comfort and accuracy?
See, now hardly we use impressions. We use sometimes for certain, which I don't want to go into that where I use impressions, but most of the time we use scans. The scans
Right,
are very fast and also becoming affordable for dentists. When we
right.
started, it's almost all 20-24 lakhs. Today, it is good scans are available 8 lakhs, 7 lakhs. So the dentists
Yes,
are able to afford to buy the scans. The biggest
right.
advantage is, so when we to take an impression, the gagging, mixing, you need an assistant, then
Yes,
and then pouring model. There is again anywhere the
yes,
error can happen. Transporting, then
yes,
again, there's so many mistakes. And then if something happens, the model breaks, then nothing we can do when we have to repeat again.
yes,
So now when I
yes,
do the scan, my scan is with me. So anytime I want to repeat, I have my data. The second
yes,
thing, there is no gagging, there is no assistant errors, there is no transportation. I do it in few seconds. It's there in the lab, and they can start scanning and then ask to print. By the time
right.
print comes the model, my crown is ready, then put it, and then that's what many people I see that crown in 24 hours like that, which is
Okay,
possible today to give because of the scans, because of
right.
the digitalization. And also the softwares are improved a lot. So we can even design quicker now. If you see that exocad, all that, there are a lot of improvements, a lot of upgrades. So we're able to deliver quick.
Okay,
So,
right.
so definitely it's an advantage for the patient, it's an advantage for the doctor, and also advantage for the lab,
Yes,
because
yes,
they have a data, and where something goes wrong, I don't need to worry like, oh, what should I do? Then I have to ask my dentist to send another impression, call the patient. So always
right.
I have this thing. So the technology display impressions are made a big difference,
Okay,
and
right,
from
right.
far off we are able to deliver in 1 day.
Yes, yes.
So
So, okay, now coming on to another terminology that we're coming across in context with dentistry is 3D printing. So, sir, just help us understand first, what is this 3D printing?
see, when say like the 3D printing used for different purposes, maybe for a
Okay,
model, maybe for a temporary crown, maybe
Right.
for a guide when we do an implant or something. And
Right.
so various purposes we are using the 3D printing. So
Right.
now, suppose I take a impression, I mean the scan, I need a model to build up a crown. I use my,
Okay.
the scan for printing a 3D. So
Right.
same, we do 3D printing for ortho aligners.
Okay.
So you need a aligner to be made, models have to be printed as per the software designed this thing, then we have to do the
Right.
pressing of the same way we do the guides. So suppose you have to place an implant, we design
Right.
everything with the guide, and then
Right.
exactly the placement of an implant and then position of the implant, everything is decided. And if somebody designs well, and it's very easy for a dentist to put an implant because the
Right.
position is there exactly, and it doesn't
Right.
need to worry about is my bar going this way, that way. So when we are doing 3D printing, we have various materials. We've got a model printers,
Okay.
you got a temporary materials. You also
Okay.
has got a guide materials. You got various materials. So whichever it is, now we have various printers. Like you have the LCD printers, you got a LED printer, you got a laser printers. So
Okay.
depending on that, and you got a various sizes, max, and then so some printers you can do 5 in this thing. Some you can do 20. So
Okay.
not 2014 at a time like that. So the 3D printing, again, depending upon the equipment, depending on the materials, we will be fixing the what for what purpose.
Okay. So basically, 3D printing, if I'm going to put it in a very basic language, would reduce treatment time and improve patient
Oh,
outcomes.
definitely. So more than that, it is actually like, earlier we used to do with this thing. Here, everything is printed in layers.
Right. Right.
So suppose you want a temporary crown, so it's a layer by layer, it's printed. So you
Okay.
have those materials available. Suppose you want a model, it's per
Mm-hmm.
layer, it's about a 40 microns or 50 microns, 100 microns, what we said. It gets printed and then it's cured and then we
Okay.
wash it and then we put it. So basically, when we're pouring the model and then doing it, here you have a printing.
Okay. Right. Wonderful, actually.
Yeah.
And I'm
So
sure it must.
printing is there in everywhere, any field. So, but now it's come in dentistry. All that is
Okay.
materials are being supported
Right.
and the softwares
Right.
are supporting us.
Okay. Right. I'm
So,
sure it must be
so
very
the,
revolutionary.
now the benches are also coming for 3D printing.
Okay. Oh, that's
So,
wonderful.
so where everything is coming now, the materials are developed for 3D printing. It's all layer by layer. You design and each layer it builds up. Now, in each layer, now the next upgradation will be characterization and then changing the layers of different colors. This will happen.
Okay. Okay.
Yeah.
Great, great. And now from denture fabrication to neuromuscular dentistry.
Yes.
What does this particular branch seeks to accomplish? And are there any recent innovations, that may benefit patients, especially with, let's say, TMJ issues and persistent jaw pain?
Yes. So it is a new field, neuromuscular dentistry. In the last 4, 5 years, we've been hearing about various terminology. Some call it TMD, some call it Department of Temporomandibular Joint Disorders,
Okay,
some call it now neuromuscular dentistry. So various names,
okay,
it's all come under one. So it's
okay,
basically, it's all one. It's not different temporomandibular. Earlier days, some call it a orofacial pain
right,
clinics. All are basically same. It basically
right,
works on facial pains, and then the science is becoming more and more evidence-based analytical. So
okay,
earlier, when you get a pain, there is not to be that kind of literature to say what is causing this pain or what is
right,
causing TMJ clicks. So what is
right,
causing earlier it was under the oral medicine department where they used to treat all this neuromuscular, I mean the MPDS, like they call it
right, sir.
myofascial syndrome,
Yes,
all
sir.
that. But now it's becoming advanced, more evolved specialty, like how digital dentistry is becoming one, how implantology, like this, it's becoming a specialty. But again,
Okay,
it's again the treatment by different people. It's
right,
not that first thing is what is causing this problem? What is the neuromuscular? So your muscles, why is it getting affected? Or is there the joints which is getting affected? Is the bone which is getting affected? What is causing this? Is it the your occlusion or is it your systemic disorders like vitamin D, calcium, or any other these things? Or is it because of some other issues like what could have caused neuromuscular this thing? Now that analysis is coming, evidence is
right,
coming, then the
right.
treatment is going in the different directions. It's not one person, we call it a
Okay,
group. So we use certain tech scans for the doing occlusal adjustments. We use JVA, jaw trackers, etc. for looking at the shifts in the jaw, and we
Okay.
lot of analysis we do blood, and then so there is
Right.
sometimes orthodontist treating, sometimes a surgeon doing orthosynthesis,
Right.
sometimes diagnosis radiology doing the all this analysis, and then probably the TENS physiotherapy. Physiotherapists working around that. So it's becoming a more of a comprehensive clinics,
Yes.
diagnosing, analyzing,
Yes.
treating from the basic cause, and then giving some splints, giving some this thing. And more in now we are going into sleep apnea and also working on sports dentistry. We are working on some
Oh,
people giving
yeah.
those things gives you that kind of pressure when you put that those
This,
like a splints
the
they
mouth
call it.
guards and
Mouth,
everything.
yeah, yeah.
Yes. Yes.
So
Okay.
whenever so those yeah, appliances are also helping certain neuromuscular forces to be given more,
Right.
especially to push. We are working on that,
Okay.
especially in the sports dentistry. So
Okay.
which will give them the perfect bite, so that that perfect bite will be. And some they are working on even for a scoliosis, all this, or even the
Oh.
gait. Will it be
Mm-hmm.
changed with changing the bite and changing the giving them a good appliances? So will that
Mm-hmm.
also is going. So it's a new field working totally, and
Yes.
definitely it's good to evolve as a
Mm.
it's not one person. I say it's all a comprehensive treatment on various specialities working.
Okay.
So
Wonderful. And now I'm going to come back to technology again. So, how are Indian dental clinics integrating CAD/CAM technology for, same day restorations? And does this technology improve the patient experience?
yeah, definitely. See, the CAD CAM is nothing but, as we discussed earlier, then impression, the
Yes.
scan, then
Yes.
it goes to the CAM, and then we design, and then we design the CAD design, and we do the mill and do the this thing. So now there are some fillings also, inlays. Now everything earlier we used to do manually, wax and then press and then do. Now today we
Yes.
scan, and then within 45 minutes it's there in the lab, and then they design, they mill within probably 2 hours, and come back by evening, and we can fix it. So
Okay.
the people call it CAD/CAM fillings. It's nothing but inlays.
Okay.
Uh,
Right.
Inlays done with the Emax, or I mean Emax is a company with a lithium
Mm-hmm.
disilicate or those things. We can mill it and then fix it. Same way the
Okay.
crown. We scan
Okay.
and then do. But not everything can be done in 24 hours. See, there's some
Okay.
maybe I can do a single crown, a monoblock, or a single this thing where I can stain and fix. But some long bridges we need to do, we need to train. We again need to do the build up with layering of a soft material. Then it will take sometime 2 3 days. So not
Okay.
everything is in 24 hours.
Okay. Right.
Some
So,
fillings can be done 24 hours. Maybe some crowns can be, single crowns can be done 24 hours. Not definitely everything in dentistry can be 24 hours.
so I would say to each his own. Probably, I think all cases are unique. So we do have a possibility, but not always.
Not all,
Yeah.
not all. Yeah, some
Okay.
can be. Many can be done, but not everything. Many patients do come to us asking, can you give it in 24 hours, such a long bridge? I told, no,
Yeah.
sorry.
It's
It,
not
it needs
possible.
2 steps, 3 steps. Not
Right.
everything CAD can do. The CAD
Okay.
can be a frame,
Okay.
but then you need to stain. So there is no replacement for the human yet.
I agree.
So when we
Absolutely.
mill it, whatever the thing, finally I had to stain. My technician has to have that, the expertise. The master technician have to have that vision to, visualize the how exactly a tooth should be, either stain or mill or do all that. So
Yes,
CAD/CAM
absolutely.
has really improved. We took out the casting, we took out all this, and definitely making big difference. But then still we need a master technician to help us out to finish the case.
Right. Right. Okay. Okay. And now I'm going to ask about the spine, or let's say the backbone of dentistry, and that's dental imaging. So, sir, now I think you just mentioned that digitalization has taken over most of the facets of the treatment modalities in dentistry. So, dental imaging, I suppose, is becoming very popular these days. So, has the use improved the diagnostic precision in dental care? And are there any safety benefits of this particular technology, for patients compared to traditional X-rays?
See, first thing is that we cannot compare earlier 2D X-rays, say call it IOPA or OPG to the CT scan, CBCTs. So
Yes, sir.
last one decade, when we had a first CT scan installed with us about almost all 8 to 10 years back, it was so expensive, the CT scans, and now it has come down to affordable to many clinics. Almost
Yes.
50% of the pricing has come down.
Come
So when
down.
you have a CT with you, the 3D imaging, no comparison to a 2D, because literally we are able to see three directions. We are able to
Mm-hmm.
see the bone quality. And more than it, my patient is able to appreciate than me.
Yes.
When he looks at three-dimensional bone, whatever the bone loss or quality of the bone, or to put an implant, how much bone is there, whether I have width, whether I have the volume of this thing, or how porous is the bone. So everything, when we look at the CT, so definitely when I'm looking at the patient is looking at with me, first thing is it's becoming a self-educative.
Yes.
Second, easy to 100% precise, even the root canals. So we
Oh.
can look at the root canals, how, if there is any variation or if there's extra canals. When we do the
Mm-hmm.
transverse cuts, we can see every extra canal or after filling. So because,
Right.
and also, zooming is quite high. So you can look at almost all at 20-25x, and then you are seeing every canal, how much is there any variation in the root, in its course, or is there an extra canal? Is there any resorptions, everything, or is there any fracture of the instruments in the earlier cases? So it's so
Mm-hmm.
much of, the diagnostic improvement because
Right.
of the 3D. So
Right.
this would not have been possible with the 2D X-rays.
2D X-rays. Yes.
So now with the diagnostic and the imaging going so, so perfect, so your planning is much easier and your prognosis decision is much, much better. And we're
Yes.
able to tell the patient, I can do it, I can't do it.
Yes.
This is the limitation, which was
Yes.
not possible earlier days. So definitely the imaging, what is the, especially the, earlier when used to send about a decade back to spiral CT, that's a
Yes.
medical CT where the patient has to lie down and then go into that 40 minutes of full body. And then in the
Yes.
place to take that only the head part and send it.
Yes.
Patients all is to become phobic. Oh, I don't want to go to CT for
Yes.
radiation, this. Now our CT is just a matter of 30 seconds over.
Yes.
So no, it's like a standing and then taking. So nobody will mind for it. So safety is so much. Your radiation has come down. When you talk of
Yes.
safety, our CT scans, what we use in the clinic, CBCT, is so compared to earlier spiral CTs, so much of
Mhm.
radiation reduction, no
Yeah.
radiation at all. So
Yes.
it's much, much acceptable for the patients and quick. They can see that time, we can explain them. Well, definitely made a big difference in the planning and they're able to convince the patients also to show.
Yes. Yes.
Implantology without CT, I don't think we can ever practice
Okay. Yeah.
because
Yes. Right.
you can't even exactly say I can do an implant or not without CT.
Yes.
And
Right.
earlier it was a big work, and now in the clinic in 10 minutes we're able to tell the patient, yes, we can do.
Yes.
And it's become easily affordable.
Yes.
So many
And
clinics have got now. That's the big thing.
yes. So I think dental imaging has actually, evolved with time, making it more suitable for patients
Mhm.
and making it a better experience for the practitioners also. Sometimes it's very difficult for them to convince a particular patient that probably, we are hand tied for certain situations. So I suppose this has actually made lives very, very
Much,
simple and
much easier.
easy.
That's what I'm
Yes.
telling. More than
Yes.
I am able to, my patient is able to get convinced when I show that.
Yes. Yes.
Big difference. So
Absolutely.
we put on a bigger screen and show them, see, this is the thing.
Yes.
And they
This is the
believe.
problem.
Yeah.
Yes. That's
And
actually
also
nice.
diagnosing root caries or small, small proximal caries, all this like it's much
Mm.
easier. And one
Easy.
scan can everything, like otherwise earlier bite wing films, all that is a
Yes. With minimum radiation exposure, and
minimum
I
radiation.
think, yes.
Yes.
Yes. And now the artificial intelligence, it's the much talked about term in this Gen Z generation.
Yeah.
So, what is the impact of artificial intelligence in diagnostics and treatment planning in context with, dentistry? And can AI help dentists, detect issues earlier and ensure more personalized care?
Yeah, some things, but still I'm not really very. this thing still seeing the AI helping me out
Okay.
because I see in the diagnodent, I see in small things where it
Right.
gives me some this thing, or when I'm designing it, it gives me a little bit of the suggestions of this and that, or but still I don't know. Me to wait for I don't know. I'm not updated, or I still don't know whether
Okay.
AI is really helping our dentists into the practice yet, or the
Oh,
softwares out there for self-diagnosis. Like I take a CT scan, I get my reports like this. Okay, this. So it may come, it is going to come, but still I don't see yet that
yet.
still we are using our intellectuals. Maybe it will
Mhm.
happen. It's just taking up. And I know a lot of people are working and a lot of patencies are going on this diagnostics. So
Right.
they will come where somebody can go take stand there. And now it is there in some of the this thing I see that's in the I don't use it, but I've seen some of the diagnodents. You go stand there and then it will give you the caries. It will give you the this thing like
Right.
this in some of the I see in the social media, but I've not used it yet.
Okay. So
And
probably
it will
let's put it
come. It will come where
to.
people can go stand in the any areas, can detect their dental caries, can detect
Mhm.
their this thing, and probably can come into clinics and then they because they
Yeah.
already diagnosed.
So we might have AI patients now instead of Google patients,
Yes, we will
most
have. I
likely.
think it's a matter of
Okay.
time where we see in the medical now a lot of this thing coming out on the AI based. And
Hmm.
then people
Okay.
go there and then take the whole reports and then come to the dental also. I see the a lot of diagnose this thing is coming, the scans especially images, but I'm not used it yet.
Okay. No, right.
It
But
will
I
come.
still feel, I still feel that AI can be supportive, still not replace, the human touch and the personalized care of a professional. So, yeah, probably the softwares, you're right, sir, that they would come eventually and they will be helpful. But again, you will always be needing a professional to guide you the best. Yeah.
Definitely, it'll give a the especially amateurs or the beginners some things what they
Mm.
miss can come out
Yes.
and then remind you there.
Yes.
And
Yes.
actually, like self-diagnostic scans or something where they go take an interval
Yes.
scan and it can
Mm.
give you, oh, you have a caries on this tooth, you have a caries on this tooth, and you have
Okay.
a gum problem. So it's going to help us out. The patients are going to come because if you have something everywhere in the, let's say in airports and all, people are going to check and then,
Yes.
with that report, they're going to come to us.
Yes. Chalo, let's
So
hope for
some are
let's
going to
let's
be
wait for that day.
beneficial.
Yeah, let's wait for
Yeah,
that day.
yeah.
Okay. And okay. Now, sir, after COVID times, there's one more term that I've heard is teledentistry. So, how is teledentistry growing in India? And you see that are there any advantages of this technology, particularly in remote areas? And also, I would like you to shine some light or shed some light on the challenges which remain in making teledentistry more accessible to the rural or the suburbs.
Now, teledentistry is a part of our practice even now earlier also. See, the people do call and then find out some things like, I have a pain, what shall I take? Or I
Yes,
have, the bleeding emergency, what shall I do? And there is
yes,
always there from earlier days also. But now, as the, Google is helping us out, uh,
yes,
in like, they just click on, and actually, in fact, teledentistry has become day-to-day practice for us now. We our call centers earlier is to give appointments,
yes.
but now I don't have the non-medical, non-dental people in call centers. Now I have
Okay.
most of the dentists doing the call centers.
Person.
Uh,
Okay.
this thing because it's no more a call center; it's a teledentistry.
Yes,
So if you get 100 calls, out of 100 calls, 80 are calling for, no, I went to this clinic and they are told this. So what do you provide? Is this okay? Or do you give
yes.
this treatment? So what will be the
Right.
cost? And what will be the
Mm.
complications? So
Yes.
what is the best? So before coming to the clinic, 100 questions are put to my
Yes.
the
Okay.
doctors. So earlier we used to say call center is just to give the appointment, so and so doctor, so and so time, open this thing. Now teledentistry has become part of the life for us. So
Yes.
people do come, and every day I also give morning or every specialist, I think in a week, one or two video calls.
Okay.
So because
Right.
people are far, they can't come and they cannot come all the way. So they keep
Mhm.
calling and then finding out, okay, I went to this dentist and Okay, this is the treatment. What do you think? Is this okay? Is this okay? So, many of the things are going, but these are all up to consultations. What else we can do?
Yes. Yes.
Right? So, emergencies,
Mm-hmm.
consultation, or
Right.
second opinions over the radiographs being sent to us. So, these things can help us out in teledentistry. And then anything more we can do, nothing more we can. Ours, dentistry, it's more of working on the patient.
Yes.
It's literally 400 dentistry all the time, our residents and we working together
Yes.
to do the treatments on the teeth. But
Yes.
teledentist in dental is only for consultation. So it
Yes.
will help the rural people, definitely to know,
Mm.
a little bit more what they're reading because so much is there in the Google and so much is there in social media. So they like to
Right.
call somebody and ask, okay, can I get my teeth white and can I come? What do I do? So,
Yes.
can I use this toothpaste? Can I use this for bleeding comes home care? Because they're reading so much. So
Yes.
teledentistry is a part of our life, and I don't know whether it will help or not, but it's definitely is part of us now.
Right. So probably follow-ups can be, improvised with
Follow-ups
teledentistry.
can be
So
improved.
just a few things. The maintenance
Emergencies
phase
can
can
be
be,
attended.
yeah,
Yeah.
emergencies, and the maintenance phase, I suppose, where
Yeah.
we usually forget the instructions. So that can also be enhanced with
Yeah.
teledentistry.
Even for
Okay.
them to reconfirm, they can. So it's a
Yes.
part of this thing now. Yeah. I think
Yes.
every dentist has to get used to this.
Yes. Yeah. And I think another thing that comes to my mind is the patients who are using the orthodontic braces. Sometimes the wire breaks, you can have accidents. So I
Yes.
think teledentistry can be utilized in such
Immediate
areas.
emergency management. Yeah,
Yes.
what you can put there, what you can.
Okay.
Yeah, that's what. It is
Yeah.
there earlier, but it has become
Mm.
more and more now because people
Mm.
got used to this.
Yes. And I think people are getting more well informed these days. You just mentioned that Google has been a great tool for them. So yeah. So yeah.
Yes.
Okay. And so can you describe how robotic assisted surgery is shaping complex dental procedures, let's say in India? And does it enhance the accuracy of surgical outcomes?
Ah, I don't know whether robotic really, I mean, my ego will not agree to say that
Okay.
robotic will do better performance than me.
Okay.
But
No, I agree.
but but definitely robotics are going to be used more and now already if you see in implants there is a robotic surgeries going on.
Right.
So, but not yet in the cosmetic dentistry, veneers and all, because there you need a eye, you need a
Yes.
perception, which is not
Mm-hmm.
possible with the robotic. Where there is something measured can be done
Mm-hmm.
definitely with robotic. So
Okay.
robotic goes by measurements at the what is there in the scans, what is then put on. So definitely in certain fields, maybe a filling is
Yes.
robotic
Can be
can be
done.
possible, but no, definitely not a root canal, I think, because the canals can
Mm-hmm.
be tortuous, canals
Yes.
can be
Yes.
this, and I don't know whether the tactile feel, whether they will get, but certain procedures, especially implants and all, I'm looking at it, robotic are going to be a major player.
Okay. Okay.
Definitely going to take some role in that, but the cost of it is much higher. Yeah, maybe
Mm-hmm.
as the scans, how the things have come down. So maybe it may definitely come in certain procedures, robotic treatments
Right.
will be there in the future.
Will be there. Done.
Uh,
Okay. Okay. So now you just mentioned that most of the dental technologies, the advanced dental technologies, they are coming down in terms of their pricing. So there are these more affordable for the average Indian patient, and if some of them are not. What options are available to ensure equitable access to the latest treatments for the Indian population?
See, ultimately it's going to happen in India. The reason is that there are so many dental colleges. If you look at this 300 plus, and then so many dentists coming. Earlier, the dentists are not available in the rural area.
Right,
Dentists, if you look at districts also, they were not available. Now, if you look at all the districts where you have a population of 1 lakh plus, you see at least about 10 to 20 dentists and also every specialist,
right,
right? And
right.
ultimately, it's going to happen because we are almost all 30,000 dentists coming, and it's going to,
Be beneficial.
yeah, definitely be beneficial. Then the price. So once it's all like an availability. Once
Yes.
the availability increases, the more and more dentists are available, automatically there's going to be some sort of competition and naturally prices are going to come down.
Come
Second,
down.
availability.
Yes.
Naturally, that's what happens. Say, it was much higher earlier. Some treatments are much lower now
Expensive.
because of two reasons. Because more people are available, there is always a competition. So
Yes.
the beneficiary is the consumer,
Yes.
right? Second, the materials, even though are increasing, some of the technology is getting available for the lesser price.
Right.
So that also can reduce the pricing.
Right.
So now also you look at it now, awareness, the Google, social media, all that. So when this is available, patients also do demand. I want
Right.
this, I want this, I want this.
Yes.
So what is happening? Even this is also upgrading every area,
Right.
whether it be even rural area, this thing and also the technology is coming available to the the all the people now. There's a lot of difference when you look at when we started 1994, 95 and 2000 and 2020. More and more dentists and more availability. People are able to avail the services there. And it's
Yes.
if you look at it, root canals or bridges, no need for anywhere to travel to different places. They have nearby.
Right.
So, so most of the technology is available, and yeah, even you look at implants now, every district, every distinct people are doing.
Yes. They're doing
So,
implants.
yeah, because availability is increasing, so I'm sure that should not be a cause. And with awareness increasing, people are able to go to smaller towns. So you will have patients there. So naturally, the availability is increasing, and distribution of patient doctors are happening. It's not like all are earlier only in the urban. Now they're
Yes.
going to the semi-urban, then they're going to the rural. Because
Hmm.
when this is saturated, there's some dentists going couple of days there.
Yes.
So things are
So,
changing. I'm sure
mhm.
the prices will come down. It will become available, and things are changing in dentistry as far as the patient is concerned.
Yes.
Yeah.
Okay. And I think we started off with the session on a very, what do I say, on a note that, patients usually are scary and they're anxious of their dentist and their dental visits. So, can virtual reality be used, in dental education and patient anxiety management? And do you see any potential future applications of this technology in routine dental care?
Yeah, virtual reality is to be used is better, definitely desensitizing the patient, taking out their anxiety, showing them the procedures. We used to tell in the pediatric dentistry desensitization
Yes.
of the kids, and then first
Yes.
appointment you should not do, you should make them, get used to the environment, then you should start. Like the virtual
Yes.
reality is also a technique, but yeah, academically it's good. Maybe colleges, maybe where you have a limited patients, all this like you can do, but not everywhere they apply this.
Okay.
But definitely it definitely helps a patient. When you show them
Right.
a procedure, you show them in an animation, you show them, takes out their anxiety and then start. It is definitely going to make a big difference when they come to the clinic.
Yes.
And that
Yes.
confidence and that kind of cooperation they're going to do is going to do. And yeah, colleges should implicate this in a uh,
This
the
would.
day-to-day, how
Hmm.
patient should be
Yes.
desensitized with the VR, and then some good clinics do it. Big clinics can do it, but
Right.
I don't think everybody use it day to day. And then,
Yeah.
but indirectly, Google is helping to do that.
Yes. In a way, in a
So
very
because
positive
when they're
way.
coming, they will see the whole procedure and come.
Yes. Okay. Great.
So yeah, good technology. This is going to definitely help, and they are using it.
Mm.
And even though we don't do, patients are also many of them are looking at the procedures. And yeah, if
Okay.
we start using in the clinics, and we have some good, yeah, the protocol SOPs developed and how to take out the anxiety, it makes a big difference in the practice.
Yes. I think a more comfortable patient would be better, no? Less minimum movements and
Definitely.
and I think maximum precision the doctor
Yes.
can offer.
Yeah.
Okay. And now about health literacy. Sir, how can advanced dental technologies contribute to improving overall health literacy in India? And what steps would you suggest can be taken to educate patients about the benefits and accessibilities of these technologies?
See, first thing is the accessibility is more important, which I told you
Right,
already, which is happening because of the availability, because of the cost coming down, affordability, all those things. And
right,
education simultaneously should happen.
right,
Awareness has to happen, and which is happening because of
right,
we are in the world of social media, especially post-COVID. There is
right,
nobody without spending about couple of hours on the social media.
right,
My grandmom too, sitting on the
right.
YouTube and this thing. So a lot
Yes,
of awareness. So now putting these two together is making a big difference in that. For us to
right.
utilize the technology, you earlier you buy a technology, you are not able to put it to the people. I have this
Yes,
like a neuromuscular. Now it's very easy to reach out to people. Yes, earlier, don't worry, all these problems you can come. We are there. So there is a kind of education which earlier we used to call by print only. Now it's much easier. So the
yes,
technology can be available and also can be promoted. This will make a
yes.
big difference.
Yes. So the technology is actually, is a very comfortable bridge between, a good professional, a trustworthy professional, and the patients. So, there'll be a better communication, better understanding, and we can actually, give
Yeah.
them better treatment outcomes. Right, sir? Okay, great. So, on that wonderful note, we really appreciate your presence with us today, sir. And I'm hoping that the enlightening information shared will be
Yeah.
valuable to many families. Thank you so much for joining us. It's really been a
Welcome.
pleasure.
Thank you. Bye bye.
Thank you, sir. And for more such informative videos, please do subscribe to our channel and press the bell icon for regular updates. Thank you once again, sir.
Bye bye.